All right. Good evening, everyone. Hope I'm audible. Let me just confirm that part. Then we'll start. Okay. Perfect. Perfect. So, good evening, students. How are you people? Hope my audio, video, everything is clear. Okay. Perfect. So, welcome to today's session. तो पहले सेशन शुरू करने से पहले let's talk little bit about exam. So, we are very close to exam. So, 2 days away from exam. And definitely, of course, a lot of anxiety, a lot of confusion, a lot of thoughts will be running in your mind. So please suno mera baat. See, this part actually is a normal thing. Feeling anxious, feeling that you might forget, that is common thing. The feeling doesn't mean, ये feeling का कोई ये मतलब नहीं है कि तुम सारे चीज भूल गए हो. बच्चे ये बात बहुत अच्छे से सुनो. आपका मतलब ये जो फीलिंग आएगा कि मतलब सर हम भूल गए, वो फीलिंग हटाओ, क्योंकि ऐसा नहीं होता है. वंस यू हैव रेड समथिंग, वहां जाने के बाद ऑटोमेटिकली क्वेश्चन देखने के बाद याद आएगा. इसके मेरा गारंटी है. ठीक है, तो डरो मत. ओके, सो आई एम वेरी नाइस रक्षा. सो द थिंग इज, बहुत सारे बच्चों को वन मोर थिंग आई वुड लाइक टू टेल यू पीपल, ये एक चीज मत किया करो. मैं बाद में भी बोलूंगा, अभी भी बोलूंगा. आंसर को बार बार चेंज नहीं करो. डू नॉट चेंज योर आंसर अगेन एंड अगेन. वंस यू फिक्सेटेड ऑन एन आंसर, जस्ट गो विथ इट. ट्राई टू चेंज वेरी मिनिमल क्वेश्चन. एक बार आंसर तुम्हें लगता है सही है, दिस इज द करेक्ट आंसर, इफ यू फील दैट, प्लीज गो अहेड विद इट. डू नॉट कीप चेंजिंग द आंसर. ओके, डू नॉट डू दिस मिस्टेक. क्योंकि यहाँ पे क्या हो जाता है कि फर्स्ट इंस्टिंक्ट में जो आंसर आता है, दैट इज 90% ऑफ द टाइम यू आर एब्सोल्युटली करेक्ट. ठीक है, यू आर एब्सोल्युटली करेक्ट. बट द लास्ट मिनट में ये नहीं हो सकता है. ये हो सकता है कि ये सोच के चेंज नहीं किया करो. प्लीज डू नॉट चेंज दैट. सो प्लीज डू नॉट मेक दिस मिस्टेक. ठीक है, ऑल राइट. So don't make this mistake. And the next important thing I'd like to tell you people is, so there'll be stretch of questions inside the exam hall. There will be a stretch of questions. So like maybe 3 question 4 question continuously you'll get in such a way that 3 question ka continuously you don't know the answer. So if you don't know the answer for 3 question, it doesn't mean that you don't know the answer for rest other question. Okay, so this stretch whenever it comes, 3 question को आंसर पता नहीं है, 4 question को रिमेंबर my words, you should answer other 146 question in that paper. ओके, पेपर 1 का बात करेंगे तो रेस्ट 146 क्वेश्चंस आर देयर फॉर यू. सो इन द थिंकिंग ऑफ 4 क्वेश्चंस, प्लीज डू नॉट डैमेज योर rest other questions. Okay, this part please remember this. Okay, all right. So let's get to the discussion. Drug of choices. So as per your request, so I'm doing the drug of choices. So drug of choice ka list, if we look at a drug of choice list, you can make one textbook out of it. Those many drug of choices will be there. But for us, we are going to understand those important drug of choices which are recently asked, and what are the traps they will keep for you and which you should not fall for. This is going to be the target of the session. क्योंकि all the time major mistake of our students is falling into the traps. Okay, so I don't want you people to make that mistake. That is why we will start with the first drug of choice. This is a very favorite question of examiner. The drug of choice for myasthenia gravis. So drug of choice for the myasthenia gravis, all of you know. Quickly tell me the answer. Come on guys, comment the answer quickly. What is the drug of choice for myasthenia gravis? Come on, quickly tell me the answer. So drug of choice for myasthenia gravis is very important answer. Do not make this mistake again. It is pyridostigmine. It is, what is that? Pyridostigmine. What is that? Pyridostigmine. If pyridostigmine is not there in the answer, sir, that is not there in the answer, what shall we do? Pyridostigmine is the best answer. If that is not there, you are supposed to give neostigmine. What is that? Neostigmine. Okay, do not make the mistake of marking any other answer. So pyridostigmine and neostigmine, the best answer is always pyridostigmine. Okay, it belongs to a group of drugs called as inhibitor of one enzyme that is only called as acetylcholine esterase. The same drug is also called as anticholinesterase drug. Okay, so this is a very very important question. Please remember the answer is pyridostigmine, not physostigmine, not physostigmine. Pyridostigmine is the answer. ठीक है सर, चलिए आगे बढ़ते हैं. What is the drug of choice used in the tensilon test? So पहले जल्दी से देख लेते हैं tensilon test के बारे में. Tensilon test is done in patients with myasthenia gravis. Okay, if tensilon test is positive, that means myasthenia gravis diagnosis is confirmed. Diagnosis is confirmed. If it is negative, that means it is cholinergic crisis. What is that? Cholinergic crisis. Cholinergic crisis. Okay, so what is that? Cholinergic crisis. So myasthenia gravis diagnosis, if it is tensilon test positive, positive, yes, 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 positive means tensilon test positive means myasthenia gravis. Very good answer. All of you are absolutely correct. Yes, the answer is edrophonium. Very good. What is that? Edrophonium. Edrophonium. Okay. Very very important, edrophonium. If somebody asks you why we use edrophonium, अगर कोई examiner ऐसा पूछ लिया, if we ask like what, why do we use edrophonium? Because it is the short acting drug. It is a short acting drug. That is the reason we use it for diagnosis only. Use it for diagnosis only. Okay. Chalo, let's go to the next one. Sjogren's syndrome. Sir, how to find Sjogren's syndrome? Sjogren's syndrome, all the symptoms are related to dryness. That includes dry mouth, dry eye, dry vagina. What are those? Dry mouth, yes, as dry mouth, and also dry eyes, and also dry vagina. Okay, so there are three important symptoms. तीनों का drug of choice अलग है. That is different drugs. That is, what is that? The mouth, dry mouth के लिए treatment that is going to be your Sevemelin. What is that? Sevemelin. What is that? Sevemelin. Sevemelin. Okay. What is that drug we are going to use? Sevemelin. Okay. For the eyes, we are going to use an artificial tear and also a lubricant. कहीं और मत चले जाना. Lubricant. I'm talking about the lubricant of the eyes. For the lubricant of the eyes, we are going to use something called as methyl cellulose. Methyl cellulose. What is that? Methyl cellulose. What is that? Methyl cellulose. And for dry vagina, we are going to give estrogen containing creams. What is that? Estrogen containing creams or estrogen containing lubricants. So this is the drug of choice for Sjogren's syndrome. Sjogren's syndrome diagnosis करने के लिए, to diagnose the Sjogren's syndrome, the antibodies you are going to get, just quickly remember, anti-Rho and also anti-La antibodies. What are the antibodies we are going to get? Anti-Rho and anti-La antibodies. Okay, all right. Very important. रोला एंटीबॉडीज. रोला एंटीबॉडीज इफ देयर पॉजिटिव, Sjogren's syndrome. ओके, अगर वो पैथोलॉजी से पूछ लिया, ठीक है, पैथोलॉजी से पूछ लिया तो वी आर गोइंग टू गेट समथिंग कॉल्ड एज glandular fibrosis. What is that called as? Glandular fibrosis. What is that? Glandular fibrosis. Glandular fibrosis. ये सारे points very very important. Then let's go to the next one. Post operative ileus and post-operative urine retention means after surgery for urine retention and for the intestinal obstruction or lack of motility, the drug we are going to use, my dear students. Very good. Quickly tell me. Let's see. First, let me see if you can remember the answer. What is the drug of choice used for the post-operative ileus and urinary retention? Come on, quickly tell me. The answer is yes, that is your bethanacol. What is that? Bethanacol. So sir, कैसा याद करें? Ileus. Ileus is related to intestine. Intestine को क्या बोल सकते हो? Bowel. And urine retention कहाँ पे हो रहा है? Bladder. Where it is happening? Bladder. So BBB. What is that? BBB. Very good. Very good. You people are absolutely correct. The technique to remember is BBB. So B for bowel, B for bladder, B for bethanacol. B for bethanacol. Okay. Very good. What is the next important question here? We have drug of choice for Alzheimer disease. Again, this was a very frequently asked previously year question. So what is the drug of choice for Alzheimer disease? कमान क्विकली बताओ बताओ बच्चों, आंसर बता दो। Come on, guys, you can tell me the answer. What is the drug of choice for Alzheimer disease? बहुत favorite question है examiner का, drug of choice for, yes, what is that? That is your donepezil. What is that? Donepezil. Very good, very good. What is that? Donepezil. What is the name of the drug? Donepezil. Donepezil is the drug of choice for what? Alzheimer disease. Alzheimer disease. Very, very important. Remember other drugs we have such as the tacrine, galantamine, all of them are there. They are not used, clinically used. The single best answer is your donepezil. What is that? Donepezil. What is that drug? Donepezil. Very good. Let's go to the next important question. That is your ड्रग इंड्यूस्ड पार्किंसनिज्म. ड्रग इंड्यूस्ड पार्किंसनिज्म किस चीज के वजह से होता है? व्हाई इट विल अकर? कॉज इज अ वेरी वेरी इंपॉर्टेंट. देयर आर टू इंपॉर्टेंट थिंग यू नीड टू रिमेंबर. वन इज योर antipsychotics, and one more is your metoclopramide. What is that? Metoclopramide. These are the two important groups of drugs जो क्या करवाता है? ड्रग इंड्यूस्ड पार्किंसनिज्म. What will cause drug induced parkinsonism? Antipsychotics causes something called as, very very important, yes, antipsychotics causes something called extra pyramidal symptom. क्या करवाता है? extra pyramidal symptom. Okay, so यहाँ पे two types of question can be asked. Directly drug of choice क्या है? That can be asked. Okay, that is one possibility, and one more possibility they can ask which group they belong to. समझ में आ रहा है बात? Which group these drugs belong to and what are the drugs used? These are the two possible questions. चलो बच्चों बता दो मुझे, drug of choice कौन है? Drug of choice for drug induced parkinsonism. Come on, quickly tell me. Haloperidol तो drug induced parkinsonism करवाता है. Haloperidol causes the drug induced parkinsonism. Very good आशीष. चलो जल्दी बता दो, what is the drug of choice? The drug of choice is a very very most important commonly used drug called as trihexyphenidyl. What is that? Trihexyphenidyl. What is that? Trihexyphenidyl. What is that? Trihexyphenidyl, which is also called as benzhexol. What is that? Benzhexol. अगर option में benzhexol is not there in the option, then you go for the next drug called as benzatropine. What is the name of the drug? Benzatropine. These are the two drugs. Please remember, drug of choice for drug induced Parkinsonism is trihexyphenidyl, are also called as benzhexol, and the drug of choice, other possible answer can be given to you is benzatropine. What is that? Benzatropine. ठीक है, और वहां पे जाने के बाद do not sit and search for this word. Sir, they did not ask us what is the drug of choice. Directly they did not ask us what is the best drug used. They can ask you, okay, what is the drug commonly used, what is the best treatment of choice. All these words means they are asking you drug of choice only, bachcho. Okay, all right, that is your trihexyphenidyl. ठीक है, तो this is the answer for your what is that drug induced Parkinsonism. Drug induced Parkinsonism. Okay, चलिए आगे बढ़ते हैं. नेक्स्ट इंपॉर्टेंट पॉइंट यहाँ पे याद रखो, एक निमोनिक. सो निमोनिक पार्क बेंज. Mnemonic, park your Benz car. Park for Parkinsonism, Benz for benzhexol or benzatropine. Benzhexol or your benzatropine. Park my Benz or park your Benz. It is the same thing. So remember, park Benz. Very good answer, Vivek. Very nice. Let's go to the next one. That is your 3 important sicknesses. भाई लोग, what is the favorite thing for examiner in this? I don't know, but every single exam इन तीनों में से ये क्वेश्चन जरूर आता है, एंड वी कीप ऑन रिपीटिंग दिस. यू लुक एट एवरी फार्माकोलॉजी फैकल्टी, ऑल ऑफ अस विल कीप ऑन रिपीटिंग दिस 3 थिंग्स ड्यूरिंग लास्ट मिनट रिवीजन, बिकॉज तीनों का ड्रग ऑफ चॉइस बहुत बहुत इंपॉर्टेंट है. चलो क्विकली बता दो, व्हाट इज द आंसर फॉर मोशन सिकनेस? व्हाट इज द आंसर फॉर मोशन सिकनेस? हाँ चलो आंसर बता दो मोशन सिकनेस के लिए ड्रग ऑफ चॉइस. Come on, quickly tell me motion sickness का drug of choice, then mountain sickness का drug of choice, and morning sickness का drug of choice, and I'll tell you how the clinical scenario comes also and how to handle this. Okay, चलो quickly बता दो. Very good, Gokul Raj. Answer is absolutely correct. Sana, correct. So, yes, Ashish, you people are absolutely correct. It is your hyoscine. What is that? Hyoscine. What is that? Hyoscine, which is also called as scopolamine. What is that called as? Scopolamine. What is that called? Scopolamine. Okay. Scopolamine ke alawa, sir, any other drug which can be used in motion sickness. Apart from that, we can also go for promethazine. What is the name of the drug called as? Promethazine. Two drugs you must remember, promethazine and hyoscine. Usually commonly used one is your, yes, the hyoscine. And please remember one important aspect, it is given in the form of a transdermal patch. And how long before? The question can be like this. A doctor decided to give a treatment by hyoscine for the motion sickness, for the prophylaxis of motion sickness. How long before the journey the person has to take the patch? When to put the patch? Remember, the patch should be given 4 hours before the journey. 4 hours before the journey. This is a very, very important point. Remember, before the journey 4 hours we need to use. Okay, please remember this point. 4 hours prior. Okay, कोई मेरा जैसा एग्जामिनर निकलेगा ना, मुझे पता होता है, I would be, if I was the examiner, I will know that all my students would have studied motion sickness hyoscine. That is why I will give that hyoscine in the question itself and ask you how long before the journey ideally it should be applied. 4 hours. 1 minute before उतना जरूरी नहीं है, 4 घंटे पहले सब काफी है. Okay. Mountain sickness. Very good. Already answer came. Mountain sickness. Please remember, very, very important answer. That is your acetazolamide. Acetazolamide. Okay. So, for example, somebody decided to go to Kedarnath. Kedarnath is at a very high altitude. At a high altitude, you are going to get a mountain sickness. For the mountain sickness, you are going to give, what is that? That is going to be acetazolamide. In mountain sickness may usually no vomiting. This is a very, very important point. Usually no vomiting. Okay, no vomiting. The patient will have what? Patient will have the high altitude, increase of respiratory rate. Okay, the patient will have dizziness, not nausea, dizziness. Not nausea, क्या होता है? Dizziness. Remember this. क्या होता है? Dizziness will be there. Okay. All right. Morning sickness. Morning sickness के लिए, if they tell you like this, if normal life daily activity of the pregnant female, daily activity is not affected. If it is not affected, then what is the treatment? If it is not affected, treatment is only reassurance. What is that? Reassurance. What is that? Reassurance. Okay, please remember this. If daily activity of the pregnant female is not affected, it is not being affected, reassurance, because every pregnant female can have, what is that? Symptoms of, yes, symptoms of morning sickness. That is quite possible. So please do not make this mistake. If it is clearly given her daily activity is not affected, see the mark करके आ जाओ, reassurance. If morning sickness is very severe, then the best answer, do not give single drug as an answer. I always explained in the classes, the drug is going to be doxylamine. The drug is going to be doxylamine. Plus one more thing we are going to add, that is your vitamin B6. So if the first option is the doxylamine, the last option is the doxylamine plus B6, the best answer is doxylamine plus vitamin B6. बच्चों ये गलती नहीं होना चाहिए. What is that? Morning sickness के लिए, if the daily life is not affected, reassurance. If it is affected, doxylamine with vitamin B6. ये भी पूछ सकते हैं, why vitamin B6 is given? Because vitamin B6 increases the gamma amino butyric acid. So this GABA will go and inhibit central nervous system, and that will also help in relieving the symptom. ये भी पूछ सकते हैं. What can be asked? Why vitamin B6 is added for morning sickness? सीधा आंसर करो, GABA लेवल को बढ़ाता है. It increases the GABA level. GABA level. Okay, then चलिए आगे बढ़ते हैं. Let's go to the next one. Mydriatics. आइए mydriatics भी एक भाई लोग बहुत important है. Mydriatics are very very important point. So let's talk about mydriatics. Before going to the mydriatics, what are the mydriatics we have? चलो कोई भी mydriatic agent बता दो. All the mydriatic agents you know. Come on guys, quickly, फटाफट. I want you to answer. Come on. I'm not seeing anybody in the comments. I'm not getting the answer. Come on, guys, tell me quickly. What are the mydriatics we know? Any drug which dilates the pupil is a mydriatic agent. Any drug which dilates the pupil is a mydriatic agent. So, what are the two groups we have? One is your, yes, very important, very, very important anticholinergic drugs. Anticholinergics. Okay, anticholinergics, and one more is your alpha agonist. So the drug alpha agonist we have, my dear students, very very important. Okay, yes, atropine is a absolutely correct answer. Alpha agonist, that is your phenylephrine. What is that? Phenylephrine. What is the name of the drug? Phenylephrine. Very good, all of you are absolutely correct. Phenylephrine causes mydriasis. It will cause mydriasis without cycloplasia. This word is very very important. Without cycloplasia. With cycloplasia, without cycloplasia, if they ask you, the answer is going to be what? Very very important. ऐसा मत किया करो सर, पहले इफ वी सॉल्व ऑल द इमेज बेस्ड क्वेश्चंस विल दे सेव द टाइम? नो, एक्चुअली वो टाइम अपना वेस्ट करवाता है बच्चों. क्यों? प्लीज ध्यान से सुनो. प्रतीक का मेरा मेरा मतलब एक बार सोच के देखते हैं. सो नाउ इन सर्च ऑफ, मतलब तुम इमेज बेस्ड क्वेश्चन को ढूंढते हुए जाना पड़ेगा. अगले क्वेश्चन इमेज बेस्ड है, द नेक्स्ट क्वेश्चन इज इमेज बेस्ड और नॉट. You have to search that. So for that you will be wasting time. Image based है या नहीं है, ये है नहीं है. So by doing that you are going to get confused. Sorry, you are going to lose your time dear. Okay, ये सब मत किया करो. ये क्वेश्चन पहले ये टॉपिक का करूंगा, पहले वो टॉपिक, ऐसा कुछ मत किया करो. सीधा क्वेश्चन आया आंसर मारो आगे बढ़ो, क्वेश्चन आया आंसर मारो आगे बढ़ो. ठीक है प्रतीक? All right. Now, so anticholinergics, we have two important drugs. For adults, we are going to use one important drug called as tropicamide. What is the name of the drug? Tropicamide. What is the name of the drug? Tropicamide. For infants, infants you want to use a mydriatic agent, then it is atropine. Then it is your atropine. Again, the question will come to you. Why atropine? Because ciliary tone is high in children. What is that? Ciliary tone is high. Ciliary tone is high. ये बहुत important point. Okay, so this is a very very important point. Why atropine is only used in children? क्योंकि ciliary tone is high. These both are possible questions for you people. And alpha agonist drug of choice is this one. And ध्यान से देखो, whenever they give you mydriatic, please look for one word. What is that? With cycloplasia, without cycloplasia. कहीं कांड ना हो जाए. ठीक है? अगर लास्ट मिनट में गए थे सर ये भी मिड्रियाटिस वो भी मिड्रियाटिक में, जल्दबाजी में दबा दिया, ऐसा कुछ नहीं है. जल्दबाजी में मिल गया, दबाना नहीं है. ठीक है? सो देखना है, पहले एनालाइज करना है. अरे यार मैं बोल रहा हूँ क्वेश्चन का आंसर. ठीक है? नाउ रिमेंबर व्हाट इज दैट? मिड्रियासिस विदाउट साइक्लोप्लेजिया और विद साइक्लोप्लेजिया. दिस इज वेरी वेरी इंपॉर्टेंट. Okay, without phenylephrine, with ciliary tone is very high in children, so that is the reason we use a long acting drug, that is atropine. Okay, long acting and ciliary tone is high. Very good. Okay, absolutely correct answer. Now let's go to the next important option. COPD का ड्रग ऑफ चॉइस क्या है भाई? COPD का ड्रग ऑफ चॉइस में बहुत लोग फंस जाते हो, क्योंकि हमें एक ही ब्रोंकोडाइलेटर वी रिमेंबर ऑन द डे ऑफ एग्जाम. हमें एक ही वन ब्रोंकोडाइलेटर वी रिमेंबर. व्हाट इज दैट? साल्बुटामॉल. हर चीज को पेल दो साल्बुटामॉल. एक ये ऐसा नहीं करना चाहिए. ओके, फॉर COPD द ड्रग ऑफ चॉइस इज योर M3 blockers. This is a very very important point. Which M3 blockers? We have two drugs. One is your ipratropium bromide, and one more drug we have something called as a thiotropium bromide. Okay, Now the question is, sir, इसमें कैसा फंसाता है? Every place where I'm telling you this is a trap, ये सारे बहुत बार हो चुका है ट्रैप, इसलिए मैं बोल रहा हूँ थायोट्रोपियम and ipratropium. And again, a patient was diagnosed with COPD. Doctor decided to give him a treatment. Which of the following drugs are given? Then you mark IPRA or Thio, no problem. But if they ask you which of the following is long acting drug, यहाँ पे फंस जाओगे. Long lasting effect, long acting drug is your thiotropium. What is that? Long acting drug is your thiotropium. Please remember what is the drug? Thiotropium. Thiotropium is a long acting drug. And sir, ये कभी पूछा गया कि yes, this was previously asked. Okay, sir, will they ask directly COPD का treatment? No, they will tell you. So ध्यान से सुनो, everyone who is listening, a patient who is a long-term smoker, 10 years, 15 years smoking history, if they give you, okay, so they will be asking majorly two types of question. One, either COPD related, okay, and one more, either it will be related to small cell carcinoma of the lung. ये दो चीज के बारे में पूछता है वो, ठीक है. सो एग्जाम का 2 दिन पहले ये सब टेक्निक इसीलिए बता रहा हूं क्योंकि एग्जाम हॉल के जाने के बाद इफ यू लुक एट दिस काइंड ऑफ थिंग्स यू शुड नॉट गेट कंफ्यूज्ड. अगर पूछ लिया तो दो चीज हो सकता है, एक पॉसिबिलिटी सीओपीडी, एक पॉसिबिलिटी मोस्ट कॉमनली आस्क्ड इज दिस वन, व्हाट इज दैट? स्मॉल सेल कार्सिनोमा ऑफ द लंग. ठीक है, चलो. Now, what is the drug of choice for bradycardia and AV nodal block? Again, this is a very very important question. Recent time में AV nodal block के लिए drug of choice क्या है? This is becoming very very popular. So please tell me what is the drug of choice for both of them? Same answer, bradycardia and AV block. Come on, come on. What is the drug of choice for bradycardia and AV? ये तो बोलने का यही नहीं है. You should keep on telling the answer. What is the answer for bradycardia and AV nodal block? Come on, guys, quickly. Yes, all of your favorite drug. What is it? Atropine. What is it? Atropine. What is it? Atropine. Atropine is the answer for your bradycardia and AV nodal block. So this is a very important question. So bradycardia का question कभी भी directly नहीं पूछेगा. He'll never ask you directly. A patient was admitted in the ICU for something. Okay, some stroke, something happened, heart rate was going down below 35 or below 40 it is going. What will be next step of treatment? Next step of treatment, as they, the thing is you are supposed to give the drug is your, yes, the atropine. What is that? Atropine. Very nice answer. Okay, organophosphate and mushroom poison and physostigmine. For all three of them, what is the favorite drug? That is your atropine. What is that? Atropine. What is the name of the drug? Atropine. For organophosphate, yes, mushroom and physostigmine. For all three of them, the drug of choice is your atropine. Okay. चलो, let's go to the next one. अगर किसी को तुमने atropine दे रहे थे, you gave a wrong dose of atropine. Okay. Yes, that is why I'm telling now. Bradycardia emergency resuscitation ही हो गई. You're absolutely correct, Pratik. Okay. So atropine overdose. Atropine, अगर you are giving treatment for some organophosphate poisoning or something like that, or somebody ingested datura alkaloids or belladonna alkaloids. What is the treatment? The drug of choice for atropine overdose, datura overdose, belladonna overdose. For all three of them, that is your physostigmine. What is that? Physostigmine. Do not make mistake of answering anything else. Physostigmine. Okay. अगर किसी को सर ये हमें कंफ्यूज होता है, भाई लोग सुनो, अट्रोपा, बेलोडोना, दतुरा, अट्रोपा, इनका पूरा नाम क्या है? बेलोडोना अट्रोपा, दतुरा अट्रोपा. These are the names of these two drugs. Okay, so that is your, what is that? Names of these two alkaloids. Plant का पूरा नाम है दतुरा अट्रोपा, बेलोडोना अट्रोपा. मतलब तीनों के तीनों में atropine itself is present. Okay, not neostigmine, not pyridostigmine. Neostigmine not used. Neostigmine not used. बच्चों गलत मत करना. Not used here. Not used here. Why? Neostigmine will not cross the blood-brain barrier. ध्यान रखो, will not cross the blood-brain barrier. Piyush, please understand. Neostigmine will not cross the blood-brain barrier, तो use नहीं करना चाहिए. ठीक है. चलो, let's go to the next question. What is that? Hyperactive bladder का drug of choice क्या है sir? Sir, hyperactive bladder का patient, if anybody comes there, hyperactive bladder patient, anybody comes there, please remember hyperactive bladder का 3 drugs, that is M3 blockers, such as your oxybutynin. Oxybutynin. What is that? Oxybutynin. M3 blocker such as oxybutynin. Oxybutynin. We have one more drug called as डोरेफेनासिन. डोरेफेनासिन. सर इसमें से मल्टीपल ड्रग्स देगा क्या? इसमें से मल्टीपल ड्रग्स नहीं आएगा. ओनली वन ड्रग दे विल गिव. देन देयर विल बी वन मोर थिंग, दैट इज योर सोलेफेनासिन. व्हाट इज दैट? सोलेफेनासिन. ओके सर, यहाँ के क्वेश्चन कैसे आता है? I'll tell you how hyperactive bladder will come, but please listen to me. Hyperactive bladder, we also use one more drug called as mirabagrone. What is that called as? Mirabagrone. So what is mirabagrone, बच्चे? Mirabagrone is a type of beta 3 agonist. It is a type of beta 3 agonist. It is a type of beta 3 agonist. So please remember, we have mirabagrone, and also we can use one more drug, that is your imipramine. What is that? Imipramine. What is the name of the drug? Imipramine. So if three groups are there, they will ask you all of the following are used in the treatment of hyperactive bladder except का क्वेश्चन आएगा. यहाँ पे मैं लिख देता हूँ, when you get the PDF, so that you will not get confused. क्वेश्चन आएगा all of the following except का क्वेश्चन आएगा. Please remember. What is that? Please remember. Okay, all right, let's go to the next one. Let's go to the next one. What is this? That is your adrenaline. Adrenaline कहाँ use करते हो? Adrenaline is a drug of choice for anaphylactic shock. What is that? Anaphylactic shock. Anaphylactic shock. So in the anaphylactic shock, we are going to use 1 in 1000. अगर कहीं पे कुछ और लिखा है, ऐसा कुछ मतलब गलती से एक जीरो आगे पीछे लिखा होता तो if 1 0 is written here and there, please do not get confused. Correct it. 1 in 10,000 for anaphylactic shock. 1 in 1000, not 10,000. 1000. 1 in 1000 for anaphylactic shock. It is given intramuscularly. ओके सो देन इट इज IV. IV के लिए कैसा देते हो? IV डोज ऑफ एड्रेनलिन इन इज 1 in 10,000 बच्चों. 1 in 10,000. 1 in 10,000 for the cardiac arrest. For your cardiac arrest. For your cardiac arrest. Okay, so cardiac arrest के लिए कैसा देते हो? That is your IV. That is your IV. Please don't get confused. Okay, then for inhalation, for asthma inhalation, for inhalation, the dilution ratio is 1 in 100 बच्चों. What is that? 1 in 100. What is 1 in 100? Okay, then for local anesthetics, for the local anesthetic, it varies. Usually we remember it is 1 in 1 lakh. So it varies from 1 in 80,000 to 1 in 2 lakh. Okay, 1 in 2 lakh. So this is the range. Okay, itna range में use करोगे 1 in 2 lakh. Okay, all right. Okay, now noradrenaline is the drug of choice for what, sir? Noradrenaline is the drug of choice for what? Noradrenaline is the drug of choice for shock. So if they don't give anything else, if they don't give anything else, simply patient was diagnosed with a shock, we don't know what type of shock. Yes, noradrenaline is the answer. What is that? Noradrenaline. So dopamine, my dear students, dopamine. Okay, please remember, it is used in acute heart failure. Okay, it is used in shock. Acute heart failure and shock. So acute heart failure mein the dose used is medium dose. In shock, what is used is a high dose. What used is a high dose. In both of them with oligouria. In both of them with oligouria. With oligouria. If with oligouria is there, drug of choice is your dopamine. Okay, so acute heart failure with oligouria or shock with oligouria, the drug of choice is going to be your dopamine. Agar if they give you any of these points, remember shock ke saath if oligouria is given or not given. If given, see the answer is your, what is that? Dopamine. Okay, simple si baat hai. Acute heart failure, so if oligouria is there, yes, just now we answered. If oligouria, if presence of oligouria, then your answer is dopamine for acute heart failure. So if oligouria is present, yes, the answer is your dopamine. If no oligouria, no oligouria. If there is no oligouria, then the best drug is your dobutamine. What is the name of the drug? Dobutamine. What is the name of the drug? Dobutamine. Acute heart failure ka drug of choice. If oligouria is present, dopamine. If no oligouria, dobutamine. If no oligouria, dobutamine. ये बहुत अच्छे से याद रखो. Dobutamine is a beta 1 agonist. Beta 1 agonist. Okay. Any confusion, sir? Any confusion? Okay. All right. For bronchial asthma, again remember, if it is for the treatment or if it is for the attack, if it is for the acute attack, if it is for the acute attack, if it is for the acute attack, then your yes, salbutamol. Then your salbutamol. Okay. For home use, for inhaler, the best drug is formoterol. What is that? Formoterol. What is that? Formoterol. Okay. So for bronchial asthma, for acute attack, salbutamol. If it is the inhaler use, that is your formoterol. What is the name of the drug? Formoterol. Okay. Let's go to the next important aspect. For your atrial fibrillation. For the atrial fibrillation, look at this. So normally, usually beta 1 blocker to be specific, beta 1 blocker is equally effective to the tough calcium channel blockers. Which calcium channel blockers? That is your diltiazem. What is that? Diltiazem and verapamil. What are the drugs? Diltiazem and verapamil. Okay. For atrial fibrillation, beta blockers are equally effective as that of calcium channel blocker. Calcium channel blockers may be non-dihydropyridine such as the diltiazem and verapamil. What is that? Verapamil. Okay. But atrial fibrillation is there. Atrial fibrillation is there with asthma. If they tell you with asthma, then the drug of choice is your calcium channel blockers only. Calcium channel blockers only. गलती मत किया करो. आस्थमा दिया हुआ है कि नहीं दिया हुआ है, ध्यान से देखो. That will be the drug of choice. Okay. So for BPH also, again drug of choice is different. Symptomatic treatment is different. What is that? Symptomatic treatment. These two are very, very important. Okay. All right. All right. So drug of choice for benign prostatic hyperplasia. Benign prostatic hyperplasia, that is your finasteride. What is the name of the drug? Finasteride. What is that? Finasteride. What is the name of the drug? Finasteride. Finasteride is a 5 alpha reductase inhibitor. 5 alpha reductase inhibitor. 5 alpha reductase inhibitor. So for BPH, please remember drug of choice is finasteride, 5 alpha reductase inhibitor. If there is a symptomatic symptom, सिर्फ symptom के लिए treat करने के लिए, okay, for the treatment of only symptoms, the best drug is your tamsulosin. What is that? Tamsulosin. So clinical practice में finasteride and tamsulosin comes in a combination. Okay. Tamsulosin is what? Specifically alpha 1A reductase inhibitor. Very good. Finasteride is a 5 alpha reductase inhibitor. So symptomatic treatment will be what is that? Tamsulosin. Agar BPH plus the hypertension is there. BPH plus hypertension is there. Then you can go for the drugs such as prazosin and terazocin. Prazosin and terazocin. So that is for the treatment of your BPH plus hypertension. Okay. Even your doxazocin. What is that? Doxazocin. Again, prazosin is a drug of choice for scorpion sting. What is that? Scorpion sting. Drug of choice for what? Scorpion sting. Okay. So don't get confused. So these are the three important points which you need to remember. Okay, about the BPH. BPH के ऊपर again very important topic बच्चों, इसको छोड़ना नहीं है. हर बार क्वेश्चन आया हुआ है, बहुत बार आता है. So either it will come from surgery, it will come from anywhere. ये इसका कोई ये नहीं है कि एक ही जगह से आएगा. It can come from both our medical side, means that is your pharmacology side, or it can come from your surgery side also. दोनों की तरफ से important है. चलिए आगे बढ़ते हैं. Let's go to the next important. What is the drug of choice for your pheochromocytoma? चलो बच्चे बताओ, what is the drug of choice for pheochromocytoma? Yes, scorpion sting के लिए the drug of choice is your prazosin. Okay, चलो आगे बढ़ते हैं. Pheochromocytoma. What is the treatment of choice for pheochromocytoma? बच्चे come on quickly बताओ. What is the drug of choice for pheochromocytoma? So if they ask you reduce the size of BPH, that is again 5 alpha reductase inhibitor itself. For to reduce the size, matlab that is why we are giving 5 alpha reductase inhibitor. That is your finasteride only. Okay, चलो pheochromocytoma का drug of choice बता दो. So pheochromocytoma का drug of choice, very good answer. That is your phenoxybenzamine. What is the drug of choice? Phenoxybenzamine. इसके साथ साथ we will also have combination of, we can combine one more drug, that is your propranolol. Okay, so single best drug पूछेगा, single best treatment for your, that is your pheochromocytoma is phenoxybenzamine. The combination best is propranolol. Okay, so drug of choice के again, what is the treatment for pheochromocytoma? That will this is the treatment. Okay, अगर question पूछेगा treatment of choice, this was your drug of choice. I agree. Treatment of choice. Treatment of choice. Treatment of choice is surgery. Treatment of choice is surgery. So remove the tumor. Remove the tumor. That will be the treatment of choice. But the best drug of choice is phenoxybenzamine. Do not make any mistakes. Let's continue to the next important. For cheese reaction and clonidine withdrawal, again cheese reaction occurs because of chemical called as tyramine. All of you already know it. Okay, it is an indirect acting chemical, indirectly acts upon the sympathetic nerves. And clonidine withdrawal, again there will be upregulation of something called alpha receptor. So हमें क्या होगा, clonidine, the patient will be taking clonidine and he will stop clonidine, suddenly he will have a rebound hypertension. In that case scenario, what to do? Okay, so that time clonidine withdrawal, the drug is your phentolamine. What is that? Phentolamine. What is that? Phentolamine. What is that? Phentolamine. Very good. Okay. All right. Let's go to the next important. Essential tremors with anxiety. If the patient is having essential tremors with anxiety, essential tremors, the patient will have tremors without any other CNS manifestations. All the nerves, everything is fine. So no evidence of anatomical changes or physiological changes, but still patient will have a tremor. This is common in young people, and in this particular time, especially essential tremors with anxiety, if it is there, the answer is propranolol. What is the name of the drug? Propranolol. What is the name of the drug? Propranolol. What is the name of the drug? Propranolol. Propranolol is a drug of choice for what? Essential tremors. Okay. चलिए आगे बढ़ते हैं. लेट्स गो टू द नेक्स्ट इंपॉर्टेंट, माइग्रेन प्रोफाइलैक्सिस. अगेन ये भी क्वेश्चन पूछा गया है. ऑलवेज दे विल आस्क यू, all of the following are used in the treatment of migraine prophylaxis. All of the following are used in migraine prophylaxis except, all except question is the possibility here for migraine prophylaxis. So please do not make a mistake. So let's understand what are the three important groups one must remember. One is your propranolol. One is your propranolol. Okay, very important. One more, my dear students, we are going to use tricyclic antidepressants such as amitriptyline, imipramine, nortriptyline. What is that? Tricyclic antidepressants. Tricyclic antidepressant. Okay, and one more, we can also use calcium channel blockers. ओके सर, ये कब से हो गया? कैल्शियम चैनल ब्लॉकर यहाँ पे भी काम आता है क्या? भाई लोग, डू नॉट वरी, इसका गारंटी मैं देता हूँ, वेरीफाइड फ्रॉम your own favorite textbook AD Tripathi. Okay, so that is your calcium channel blockers also used in the migraine profile axis. Okay, migraine profile axis. So all of the following except पूछेगा, so ध्यान रखो, propranolol, TCA and calcium channel blocker, all three of them can be used in migraine prophylaxis. So please do not make any confusions here. All of the following except is the possible question. So let's continue. Okay, so attack of migraine, if the patient is having an active attack of migraine, attacks of migraine, okay, single best answer is your triptans. What are the drugs used? Triptans. What are the drugs used? Active attack of the migraines, we are going to use triptans, such as sumatriptan, such as sumatriptan. Okay sir, chalo. For ventricular arrhythmias, again a trap, but before going to ventricular arrhythmia, glaucoma का बारे में पढ़ लेते हैं ना. Okay, for glaucoma, when we are speaking, the first line of choice, first line drugs is always your beta. First line drugs is your beta blocker. First line drugs is your beta blockers. Do not get confused. First line drug for the glaucoma is a beta blocker. If there is a patient with bronchial asthma, if bronchial asthma is present, if bronchial asthma plus glaucoma is there, in that case, what we are going to use? We are going to use one your favorite lol called as your betoxolol. The drug used is betoxolol, my dear. Okay, what is the drug used? Betoxolol. Betoxolol is the first line drug used in the treatment of what? Glaucoma. Is the patient is having what? Bronchial asthma. If no bronchial asthma, if no asthma, then your drug is your timolol. Okay, ये ध्यान रखना है आप लोगों को. Timolol. What is that? Timolol. So if they just blindly give you what is the drug of choice for glaucoma? Timolol, sir. What is the drug of choice for glaucoma with a patient who is having a history of bronchial asthma? Betoxolol. What is that? Betoxolol. Okay. All right. Let's go to the ventricular arrhythmia. Ventricular arrhythmia, again, first treatment, first line management is not always the drug. So they will never ask you what is the drug of choice for ventricular arrhythmia. Rather, they're going to ask you, patient developed a ventricular arrhythmia, that is ventricular fibrillation or ventricular flutter. And during this time, during the ventricular flutter fibrillation, what will be your next step of management? If there is an issue for sound, please close the video and open once again. Let me check if audio is coming on. Yes, it is absolutely fine. So please close the video and open it once again. So for the ventricular arrhythmias, first line treatment will be your defibrillation. So if audio is the issue, please close it and open. One sec. Close and open video. All right. So listen to me. Listen to me. First line is defibrillation. Electric defibrillator. Electric defibrillator. Okay. Yes. Okay. Then if the first line drug of choice, they will ask you. So the drug of choice, if they ask you, the first answer you should be telling is amiodarone. Okay. What is that? Amiodarone. Okay. If ventricular arrhythmia, arrhythmia is due to digoxin, if it is due to digoxin, then the drug of choice is your lidocaine. What is that? Lidocaine. What is the name of the drug? Lidocaine. So please remember, what is that? If ventricular arrhythmia is due to digoxin, lidocaine. If it is due to any other cause, amiodarone, फर्स्ट स्टेप और फर्स्ट लाइन ऑफ मैनेजमेंट डिफिब्रिलेशन, ये पूरा ऑर्डर ऐसे ही यूज करना है, गलतियां होने नहीं देना चाहिए. ओके, सो again atrial fibrillation and flutter already we discussed. Beta blockers, beta blockers equally effective to that of calcium channel blockers. So we already know about this. So let's continue to the next important. So what is about PSVT? So for the PSVT, drug of choice, the first drug you are going to use is adenosine. What is that? Adenosine. Drug of choice is adenosine IV. Adenosine IV. Okay. So if fails, if it does not respond, if fails, then you can go for verapamil. Okay, then you can go for verapamil. Okay, so verapamil, propranolol, you can go for any other drugs which decrease the heart rate. But first drug of choice, hamesha adenosine. Okay, and other things what we can do in PSVT. What are the other things we can do in PSVT? We can go for a carotid massage. We can go for a carotid massage, and we can also go for Valsalva manure. What is that? Valsalva manure. What is that? Valsalva manure. So these are the three things. So again, यहाँ पे three things आ गए तो what will be the question? All of the following are used in the treatment of PSVT except. So what will be that? Adenosine, carotid massage, Valsalva, and some other drugs they would give. So answer will be the last one. Okay? ये गलती एक मतलब ये गलती कैसा होता है क्योंकि we will not look at all of the following are used or all of the following drugs are used. So all of the following drugs use करेंगे तो पूछेगा तो they will ask about drugs only, but if they are asking all of the following are done in this thing means that will be adenosine. Okay, यही trap होगा. So congestive cardiac failure. All of these are PYQ के basis पे drug of choice. The session name itself we have named it as drug of choice. Okay. So what is the drug of choice for pharmacology? That is Dr. Maruti. Okay. वैसे ही सारे drug of choices which are previously asked. Congestive cardiac failure. Congestive cardiac failure के लिए अगर question पूछा treatment of choice for congestive cardiac failure is very important aspect. What is that? So please remember that is the sacubitril. What is that? Sacubitril plus valsartan. What is that? Sacubitril plus valsartan. This is the best combination. If all the other drugs, if other drugs fail, okay, if other drugs fail, or ejection fraction in the question, ejection fraction is less than or equal to 30%. If the ejection fraction is less than or equal to 30%, then only you are going to give the patient digoxin. Then only you are going to give the patient what is that? Digoxin. Okay, so the best combination is sacubitril plus valsartan. Okay, other drugs which can use are ACE inhibitors. Then we can use ARBs, and also we can use aldosterone antagonist. Okay, so these are some important drugs which you need to remember. So for severely low ejection fraction, I am telling you people, remember, yes, low ejection fraction, EF. Okay, so very low. Other drugs fail, our ejection fraction is very low, that is less than or equal to 30%. That will be your digoxin. Okay, got it, Ishan? Perfect. Angina का treatment of choice. Guys, I want you to remember, angina के अंदर बहुत सारे drugs है. Angina का drug of choice अगर पूछेंगे, कुछ इधर उधर कुछ भी नहीं करना है, सीधा ढूंढो nitrates. So the drug of choice for angina is always nitrates. Okay, treatment of choice for angina is nitrates. Okay, all right. Let's go to the next one. Okay, very good. Nitrates is a correct answer. Now when we look at a hypertension is such a topic. बहुत सारे क्वेश्चन आते हैं. ये मतलब it will be coming from multiple places, such as your very importantly, yes, comes from your medicine and also from pharmacy. Okay, ये combination वाला game होता है. So ये combination वाला game very important ones you need to understand. For example, diagnosis of hypertension. And we look at age less than 60 years. The first line drug of choice is your thiazides. What is that? thiazides. Okay, hydrochlorothiazide. If the first diagnosis, the age, if it is less than more than 60, usually preferred are your calcium channel blockers, which are dipines. What is that? Dipines, dihydropyridine, such as amlodipine, nifedipine, nimodipine. Okay, so this is will be your diagnosis based on the age. Then hypertension में और क्या आता है? So hypertension combinations are very important. Hypertension with some other disease combination. So such as HTN stands for hypertension. Hypertension with BPH. So I will be writing the combination. You people will guess the answer. बाद में मैं बताऊंगा. Okay. Hypertension plus, for example, gout. Okay. For example, hypertension plus diabetes mellitus, all of them are standard combination. तो आप लोग बताते चलो फर्स्ट वन का क्या होता है, सेकंड वन का क्या होता है, थर्ड वन का क्या होता है. क्विकली आई वांट यू टू टेल मी. ओके, hypertension in pregnancy. So these are few very commonly asked combination. Okay, hypertension plus dyslipidemia. Okay, chal. So Metsyko says diabetes plus hypertension plus BPH. That is your alpha blockers. Alpha blockers such as doxazocin or prazosin. What is that? Prazosin. And they will also cause one more side effect, that is only called as orthostatic hypotension. Again, this was a previously asked question. Orthostatic hypotension. This is also a very important question. Okay, and this इसी का दूसरा नाम कहला जाता है first dose effect. What is that called as? First dose effect. What is it called as? First dose effect. बच्चों, what do we call it as? First dose effect. Prazosin, doxazocin, terazocin, alfuzosin, all the zocins. ठीक है sir? Very good. Hypertension plus gout. यहाँ पे दो क्वेश्चन आता है, विच वन टू गिव, विच वन नॉट टू गिव. ओके, सो हाइपरटेंशन प्लस गाउट, गिव विच वन? गिव योर वेरी फेवरेट ड्रग, दैट इज योर losartan. बच्चों, what is that? Losartan. What is that? Losartan is the drug of choice for hypertension plus gout. But in this case, not give is which one? Do not give in a gout patient is your thiazide. What is that? Thiazides. Okay, no confusion. Hypertension, gout is there, losartan is given. Do not give which one? Thiazides. Do not give which one? Thiazides. Do not give which ones? Do not give your thiazide diuretics. ओके, सो दिस इज अ वेरी इंपॉर्टेंट. एआरबी में भी पूछेगा कौन सी एआरबी? द एआरबी विथ यूरिकोसूरिक इफेक्ट. व्हाट इज दैट? Uricosuric effect. That will be losartan. Okay, hypertension plus diabetes mellitus. First preferred is ARBs. If ARBs are not there, you can go for ACE inhibitors. Okay, what is that? ACE inhibitor. What is that? ACE inhibitors. Okay, so that is your diabetes plus hypertension. Okay, diabetes mellitus plus hypertension. Okay, drug of choice in pregnancy. First drug is your labetalol. Again, I'm telling you, if pregnant female has a hypertension with bronchial asthma, labetalol is not given. Okay, if labetalol is not there, you can go for your hydralazine. Is that hydralazine? Okay, then you can go for, if that is not there, alpha methyl dopa. If that is also not there, you can go for dipines. That is also not there, dipines. Labetalol is the absolutely correct answer, but be prepared like that. Labetalol is not given if asthma is present. If bronchial asthma is present, then not given, not used. If the pregnant female has a bronchial asthma, then nahi diya karo. Kaun si? Yes, then we are not going to give. Yes, that is your labetalol. This is again a question asked. Dyslipidemia hota hai. Again, the best drugs are your alpha blockers only. Best drugs are alpha blockers. All of these are previously asked questions. So they'll give you a case scenario and they will ask you to answer. Okay. इसके बाद में आते हैं next important hypertensive emergency. This is also a very very important hypertensive emergency. Now what will you give for hypertensive emergency? What will you give for hypertensive emergency? So remember, hypertensive emergency, according to the textbook, the best drug which we are supposed to answer in our exam is nicardipine. What is that? Nicardipine. Okay, but in the hypertensive emergency only, hypertensive emergency can be due to many other cases. So hypertensive emergency can come with, for example, stroke, retinal hemorrhage, myocardial infarction, acute renal injury, hypertensive encephalopathy, all these are there. But hypertensive emergency with if it is with myocardial infarction, the best drug, please remember, that is your sodium nitroprusside. What is that? Sodium nitroprusside. Okay, not nitroglycerin, nitroprusside. Sodium nitroprusside is the better drug if there is with MI. If it is just plain hypertensive emergency, nicardipine. अगर nicardipine option में नहीं देता है, you can also go for labetalol. So best answer is nicardipine. मुझे ये याद रखवाना था, nicardipine. Okay, then remember इंट्राक्रेनियल हाइपरटेंशन, ये बहुत कंफ्यूजन पॉइंट है. इंट्राक्रेनियल प्रेशर नहीं है, इंट्राक्रेनियल हाइपरटेंशन. ओके, व्हाट इज द आंसर? इंट्राक्रेनियल हाइपरटेंशन. ओके, एंड इंक्रीज ऑफ इंट्राक्रेनियल प्रेशर. इंक्रीज ऑफ इंट्राक्रेनियल प्रेशर दो अलग सीन है. सो इंक्रीज ऑफ, yes, increase of your, what is that? Increase of intracranial blood pressure is different from increase of intracranial pressure. Okay, तब क्या करें बताओ? प्रेशर बढ़ना अलग है, सिर्फ ब्लड प्रेशर बढ़ना. Okay, so again we are going to use calcium channel blockers only, such as for example your nimodipine. What is that? Nimodipine. Okay, nimodipine. For intracranial pressure increase, of course, your mannitol. If there is an increase of intracranial pressure, mannitol. If there is an increase of intracranial pressure, mannitol. Okay. Then nifedipine. Nifedipine also tocolytic agent, used in which condition? As used in the condition of what? Used in the condition of preterm labor. Okay, let's go to the next important aspect. This one is like a very important question. It's a direct, they will ask you which of the following is most potent opioid. Okay, they'll ask you what? Which of the following is most potent opioid? So what will be the answer? Most potent opioid जो clinically use किया जाता है, most potent opioid. So most potent opioid बच्चों याद रखो, most potent opioid is your fentanyl. What is that? Fentanyl. What is the name of the drug? Fentanyl. Most potent opioid is your fentanyl. ये बहुत बार पूछेगा. Every alternate, every second time or third time of the exam, they will keep asking this most potent opioid. Fentanyl. Most potent is fentanyl. यही confusion होता है. And most importantly, remember, opioids are opioid agonist बच्चों. What is that? Opioid agonist. ये भी confuse मत करना. It is a opioid agonist. Opioid agonist. Very good. Answer is fentanyl. Prototype opioid. As Hardik said, prototype opioid is your morphine. Okay, what is that? Morphine. Morphine is a prototype opioid, but most potent opioid is your fentanyl, and these opioids are agonist drugs. Both of them are agonist only. Opioid agonist. Fentanyl also, and also your, what is that? Morphine. Both of them are opioid agonist. Okay, sufentanil उतना clinically use नहीं होता है. There are other fentanyl, sufentanil, carfentanil is there. So among the given option पूछेगा, among the given option most potent will be usually fentanyl. Okay, Let's go to the next answer. If the patient is having a opioid overdose पहले देख लेते हैं. He won't directly ask you the drug of choice. तो पूछेगा क्या? He will give you clinical feature. Okay, so you need to look at the clinical feature. उसके बाद में you are supposed to give the treatment. So what is the treatment and what are the clinical feature? One of the most important, that is only your opioid induced coma. Opioid induced coma. Okay, very good. Answer is metpsycho. The answer is naloxone. But I want you to look at these particular clinical features. Okay, the patient will have decrease of respiratory rate, and also patient will have pinpoint pupil. So these are the three clinical signs of opioid overdose. And opioid overdose के बारे में पूछने का possibilities are higher, because compared to last maybe 10-20 years, in India opioid overdoses have been found in recent times. मतलब आजकल के recent times में opioid overdose के cases मिल रहे, so that is why they might ask you with the clinical features itself बच्चों. Okay, so what will be the treatment? All of you are correct. Immediately IV naloxone. Okay. All right. So let's go to the next important, that is Parkinson disease. So Parkinson disease, again, two types of things you need to remember, whether it is a early onset Parkinson's, means if it is young people or if it is a old age. Both of them the treatment is different. तो इसलिए मैं यहाँ पे डाला हूँ उस चीज को. That's why I have put it here. So please do not get confused. Early onset Parkinsonism. The drug of choice is going to be your D2 agonist. Such as pamipexole. Any one of them you can use, pamipexole, or you can also use ropinirole. What is that? Ropinirole. Okay, pamipexole or ropinirole. Okay, this is one important point. And if it is a old age or late onset, इनको तो कुछ ज्यादा ये मतलब side effects का उतना effect नहीं पड़ेगा. So then we can go for levodopa plus carbidopa. Levodopa plus carbidopa. Okay, for old age people, what is that? Levodopa plus carbidopa. Now the next important question, the new drug available in the form of patch form, transdermal patch. They can also ask this question, which newer anti-Parkinson drug comes in the form of transdermal patch? कौन सी? Transdermal patch. So that is only your rotigotine. What is that? Rotigotine. What is the name of the drug? Rotigotine. Newer drug available in the form of, that is your transdermal patch. Then again, epileptic drugs, anti-epileptic drugs, and their drug of choice. Okay, so the first anti-epileptic drug which they can ask you is GTCS, for the generalized tonic-clonic seizure. So we can use both the drugs. We can use for carbamazepine and also your valproate. What is that? Valproate. Okay, this is a easy question. The next important answer question will comes to you. Pregnant female with epilepsy. Okay, thank you so much. So pregnant female with epilepsy. तो again यहाँ पे हमारा बच्चों को कंफ्यूज होने का संभव होता है. याद रखो, eclampsia is different, pregnant female with seizure is different. Okay, eclampsia will have other symptoms such as, yes, hypertension, proteinuria, pedal edema, and seizure. Then only eclampsia, then the drug of choice will be your MgSO4. समझ में आ गया? Eclampsia का drug of choice MgSO4. So plain epilepsy with a pregnant female. Okay, so what will be the drug of choice? That will be your levetiracetam. सर अगर लेविट्रिसिटम हमें नहीं दिया तो क्या करे? कुछ नहीं, टेंशन मत लो. उधर साइड में दिया होगा लेमोट्रिजिन. साइड में there will be lamotrigine. So either one of them is safe. Very good. Thank you. Let's continue. Let's continue. The next important question आएगा कौन सी question in the drug of choices. So please remember absent seizure. What is that? Absent seizure. Absent seizure. You all will find out what is that. Yes, find out the case very easily. Zone the small child zoning out in the school. Done diagnosis. What is that? Absent seizure. So absent seizure, look at the age. Look at the age. Age agar less than 2 years, age is less than 2 years, then you are going to go for ethosuxamide. Ethosuxamide. Okay. So one time one examiner asked very interesting question. What is that? A child was diagnosed with absent seizure. He was decided to give a drug. What is the mechanism of this drug? देख रहे हो? So we should know the child was diagnosed with less than 2 years. So we will give ethosuxamide. What will be the mechanism? It is a T-type. What is that? A T-type calcium channel blocker. Which type? T-type calcium channel blocker. T-type calcium channel blocker in the central nervous system. ठीक है सर? Very good. All of you are absolutely correct. Okay. If age more than 2 years, again the answer is going to be valid. Okay. So I can go on further, like we can go on and on with the mechanisms. Now don't confuse, because most of the anti-epileptics work by your, what is that? Work by your sodium channel blockage. Okay. But ethosuxamide blocks only calcium channel. Valproate blocks both calcium and sodium channel. But levetiracetam ka mechanism of action also till now पूछा नहीं है, but there is a high likely that we can ask you. It will inhibit something called as SV2A. Sir, SV2A होता क्या है? SV2A is a name of the protein which is present in the synaptic vesicles. Vesicular protein, synaptic vesicular protein, उसको inhibit करता है. That is a mechanism of, yes, mechanism of your levetiracetam. These are the possible things which can be asked from your epileptic drugs. Okay. Then next important, I'll just give you a few points. Just go through side effect of phenytoin. Side effect of phenytoin, go through once before going to exam. And also side effect of valproate. Both are important. Side effect of valproate. Okay. Both of them are very important. Please go through these things also. So the next important, for example, if there is a, since we are talking about anti-epileptics, what is a drug of choice for trigeminal neuralgia? Trigeminal neuralgia. Trigeminal neuralgia. So the treatment of choice for trigeminal neuralgia is carbamazepine. Carbamazepine. Okay, very good, very good. So teratogenic is absolutely correct side effect. So ये बहुत बार पूछने का संभव बहुत ज्यादा होता है, इसलिए ठीक है. And I can go on and on, but I don't want to waste your time. Just 2 days before the exam, मुझे इतना ही देना है. ये क्वेश्चन का डायग्नोसिस का, like this case, what is the drug of choice? सीधा आंसर मार्क करके बाहर आ जाना से. So that is why I am going this pace. Okay, let's go to the next one. BPD. BPD causes, BPD का ट्रीटमेंट क्या होता है? BPD का causes psychiatric causes है, but BPD treatment is your lithium. So lithium के बारे में क्विकली बता देता हूँ. सुन लो अभी, जस्ट सुन लो तो भी याद हो जाएगा. Don't worry, तो भी याद हो जाएगा. Lithium causes side effects such as Epstein anomaly. It causes side effects such as nephrogenic diabetes insipidus. It will cause tremors, hyperthyroidism, hyperthyroidism, and also the next important side effect, the patient can also have ECG changes. These are the side effects of lithium. ECG change, hyperthyroidism, especially basically the thyroid disorder. Then we can also get, what is that? Yes, you can get your most important, please listen to me, tremors, and also your very important, that is Epstein anomaly. And the very important point is that it does not cause extra pyramidal side effect. ये ट्रैप बहुत बार पूछा गया है. Lithium does not cause extra pyramidal effect. Lithium will not cause your akathisia, tardive dyskinesia, okay, perioral tremors, dystonia. These are not caused by lithium. So question aayega, all of the following can be seen after using lithium except, and this was a previously asked question. Okay, so please remember. Smoking cessation. What is the drug of choice for smoking cessation? So the drug of choice is your bupropion. What is that? Bupropion. Bupropion is a type of, yes, it is a type of atypical antidepressant. ये कौन सी drug होता है? It is antidepressant. It works by 5-HT-A receptor subtype. 5-HT1A receptor. 5-HT1A subtype receptor. Okay. Then we can also use, apart from bupropion, we can also use the next one, vernaxilin. Agreed. Okay. वेरनासिलिन से ज्यादा कॉमनली यूज्ड वन इज बुप्रोपियन. ज्यादा कॉमनली यूज्ड वन इज बुप्रोपियन. सर एक काम करता है कि अभी भी डाउट है सबको, सर बुप्रोपियन डज इट वर्क? यस, बुप्रोपियन एक बार टैबलेट खाते हैं, आई डोंट वांट टू स्मोक, ऐसा मैजिक नहीं करता. ओके, सो बुप्रोपियन का एक कोर्स ऑफ ट्रीटमेंट विल बी देयर. इफ इट इज डन, यस, देयर इज ए पॉसिबिलिटी ऑफ ट्रीटमेंट. ओके, चलो. बेंजोडाइजेपिन्स. बेंजोडाइजेपिन्स का क्वेश्चन क्या क्या आता है? बेंजोडाइजेपिन्स ड्रग ऑफ चॉइस फॉर, yes, that is your status epilepticus. Status epilepticus. Status epilepticus. And also drug of choice for active seizure. And also active seizure. And also for active seizure. Active seizure. So remember, for both of them, best answer drug of choice you are supposed to give is IV lorazepam. IV lorazepam. Okay, what is the drug? IV lorazepam. If not given, if not present, if not there in the, if not in the option, then you can go for IV midazolam. IV, what is that? Midazolam. What is that? Midazolam. Okay, so please remember. So IV midazolam. If not given in the answer lorazepam, ध्यान से देखो, the drug of choice is going to be आप लोगों का midazolam. आप लोगों का कौन सी होता है? Midazolam. Okay, so this is a very important point. Okay, so please remember that is this. Okay, and next question from the benzodiazepine. So these are the drug of choice for major anxiety disorder. Major anxiety, wait, let's change the word. Major नहीं है, generalized anxiety. Major नहीं, generalized anxiety disorder. Generalized anxiety disorder, again benzodiazepines. Benzodiazepines, you must remember. Okay, again the next important, अगर benzodiazepine overdose होता है, antidote for benzodiazepine. Antidote for benzodiazepine. Antidote for benzodiazepines, बच्चों, that is your flumazenil. What is that? Flumazenil. What is that? Flumazenil. What is the drug used? Flumazenil. Okay, so these are the questions which can come from benzodiazepine. Okay, for obsessive compulsive disorder, the drug of choice for both of these condition, premature ejaculation and your obsessive compulsive disorder, what is the drug of choice? Remember, they are your SSRIs. What is that? SSRIs. What are the SSRIs we have? Yes, drugs. Come on, guys. SSRI drugs. All of you know. Yes, your fluoxetine. What is that? Fluoxetine. Okay. Then we have one more drug, such as your paroxetine. Paroxetine. Then you have your citralopam. Then also we have acetalopam also. Okay. But यहाँ पे confuse होने वाली point. What is that? We have a drug called as duloxetine. Okay, oxetine सुनते ही हम लोग क्या करते हैं? We will start to think that it is also a SSRI, but it is a SNRI. It is a SNRI. ये थोड़ा confusing point है. Please don't get confused. Duloxetine is SNRI. Rest other oxetines are SSRIs. So यहाँ पे SSRIs are the drug of choice. Okay, so गलती नहीं होनी चाहिए. Okay, So nocturnal anuresis, if the child is having bedwetting, nocturnal anuresis or bedwetting, nocturnal anuresis or bedwetting. So in that case scenario, the drugs which can be used are, the usually used is desmopressin. What is that? Desmopressin. If desmopressin, and also they can give you one more group of drugs, tricyclic antidepressant. तो अगर दो groups of drugs है, if two groups of drugs are there, again यहाँ पे question बनेगा all of the following except, all of the following except are used in the treatment of bedwetting or nocturnal anuresis except option 1, option will be desmopressin, then will be your imipramine, then will be your nortriptyline, something else will be given. The something else will be the correct answer. So please remember, tricyclic antidepressants are imipramine, nortriptyline, amitriptyline. Okay, very good, very good. Desmopressin and also TCA. ठीक है. Hyperthyroidism, again hyperthyroidism के अंदर drug of choice is your TPO inhibitors, TPO inhibitor. So hyperthyroidism के अंदर pregnant female का पूछेगा. ठीक है. Pregnant female is the usual question. So pregnant female usually drug of choice क्या होता है? If it is first trimester, if it is first trimester, the drug of choice, my dear students, it will be your PTU, that is propyl thiouracil. Okay, if it is second and third trimester, second and third trimester, then the drug of choice is your carbimazole. If carbimazole is not there in the option, you can go for other things such as methimazole. कार्बिमazole, मेथिमazole. ओके, ये बहुत बहुत इंपॉर्टेंट क्वेश्चन. दिस इज अ वेरी वेरी इंपॉर्टेंट क्वेश्चन. दिस आस्क्ड इन बोथ नीट पीजी एग्जाम्स आल्सो. आई मीन जो इस बार डिजास्टरली मिराकुलसली रातों रात कैंसिल हो गया वैसा वाला नहीं, बट यूजुअली प्रीवियसली कंडक्टेड नीट पीजीस में पूछा गया. ओके, ऑलराइट. हाइपोथायराइडिज्म, ऑल ऑफ यू नो लेवोथायरॉक्सिन, levothyroxine. Okay, and if levothyroxine is not there, and for emergency condition, for emergency, then we have one more drug called as leothyronine. Again, leothyronine is not available in India. It is a T3 analog and levothyroxine is a T4 analog. इतना simple. Okay, अब इस बार तो वैसे ही हुआ ना, रातों रात सब लोग इधर उधर जर्नी करके सब लोग मतलब हाँ भाई सो जाना है, सुबह उठ के एग्जाम आज चले जाएंगे, रात को न्यूज आता है. और आधे बच्चे तो ये भी हो गए कि रात को जल्दी सो गए थे, वो फोन साइड में फेंक दी. ठीक है, एग्जाम हॉल पहुंच गए. ओके, so what is a drug of choice for acromegaly? Best drug they can ask you is, the best drug is somatostatin analog. Somatostatin analog. What is that somatostatin analog? We have a drug called as octreotide. Okay, what is that? Octreotide. If that octreotide is not there, you can also use lanreotide. Okay, what is that? Lanreotide. Octreotide and a lanreotide. Somatostatin analogs. Okay, then यहाँ पे अगेन स्मॉल कंफ्यूजिंग पॉइंट, ध्यान से पढ़ना चाहिए. इफ प्रोलैक्टिनोमा इज गिवन, इफ ट्यूमर इज प्रेजेंट सर, ओके, octreotide and lanreotide, both of them can be used. Okay, all right. So सर अगर दोनों दे दिए तो क्या करें? सर दोनों दे दिए तो मतलब और एक टाइड दिया होगा, देख लो. ठीक है, यूजुअली octreotide will be given. ओके, चलो. पेग्विजोमेंट यूज करेंगे कि नहीं करेंगे सर? पेग्विजोमेंट इज नॉट यूज्ड. व्हाई नॉट यूज्ड? बिकॉज़ इट कॉजेस वन साइड इफेक्ट, विजन डिस्टरबेंस, इसलिए यूज नहीं करते हैं. एंड दिस वाज अ डायरेक्ट क्वेश्चन, आई थिंक लास्ट ईयर जनवरी एग्जाम में पूछा गया था. व्हिच ऑफ द फॉलोइंग somatostatin analog is used in acromegaly? ओके, आंसर वाज octreotide. ओके, चलिए. प्रोलैक्टिनोमा, सर प्रोलैक्टिनोमा यहाँ पे ध्यान से पढ़ना चाहिए. हाइपर प्रोलैक्टिनेमिया दिया हुआ है, प्रोलैक्टिनोमा दिया हुआ है. ठीक है, यही ट्रैप है हमारा. ट्रैप को हम रास खोल देंगे, क्योंकि एग्जाम का 2 दिन पहले ये ट्रैप सारे बता रहा हूं, ताकि वहां पे जाने के बाद ओके हाँ हमें ध्यान से देखना है इस चीज को, है ना. सो प्रोलैक्टिनोमा's ड्रग ऑफ चॉइस इज, व्हाट इज द ड्रग ऑफ चॉइस? हाइपर प्रोलैक्टिनेमिया का ड्रग ऑफ चॉइस क्या है? So hyperprolactinemia का drug of choice is your bromocriptine. Bromocriptine. Okay. So what is the drug? Bromocriptine. What is the drug? Prolactinoma का drug of choice is cabergoline. सर दोनों तो एक ही ग्रुप का है, ये कौन सी बकवास, ये कौन सी बकलोल हो जाता है हमारा, कंफ्यूज क्यों करवाते हो? अरे कंफ्यूज नहीं करवा रहा हूँ, एक्चुअली हाइपर प्रोलैक्टिन में मतलब प्रोलैक्टिन लेवल बढ़ा हुआ है बिकॉज ऑफ सम एनी अदर कॉज, तो हमें अभी कम करवाना है, कम करवाने के लिए ब्रोमोक्रिप्टिन दे दो बिकॉज इट इज ए शॉर्ट एक्टिंग, है ना। सो ट्यूमर बना हुआ है, सो ट्यूमर का साइज कम करवाना है, सो उस टाइम पे क्या करना चाहिए? Cabergoline, yes, sir. Does it decrease the size of the tumor? Yes, of course, it decreases the size of the tumor. Okay. Okay. Let's go to the next one. What is that? Precacious puberty, precacious puberty, prostate cancer, endometrial cancer, endometriosis. ये सारे चीजों में एक ही थिंग कॉमन है. What is that? Continuous GnRH analogs, continuous GnRH analogs, continuous GnRH analogs. Okay, so such as naparelin, buzarelin, lupriolide. Okay, all of you know that continuous GnRH analogs are given for all these cases. Okay, continuous GnRH analogs, why we will give? If you give a continuous GnRH analogs, it will decrease FSH, LH. If it will decrease FSH, LH, that will decrease testosterone, estrogen and progesterone. Okay, continuous GnRH analogs. अगर delayed puberty हो गया, puberty late हो गया, late menarche आ गया, so during the case of late menarche, हाँ डॉक्टर साहब दे दीजिए किस चीज को? That is for your pulsatile GnRH. What is that? Pulsatile GnRH. Okay, pulsatile GnRH analogs. Okay, very good, all of you are correct. तो एडिसन डिसीज के लिए क्या ड्रग दोगे? What are the drugs given for Addison disease? Addison disease is a chronic adrenal deficiency. Chronic adrenal deficiency. Okay, so for the chronic adrenal deficiency, we will give corticosteroids. जो क्या कर देते हो? Corticosteroids. What is the drug given? Corticosteroid. Corticosteroids. Corticosteroids, and also we can use the drugs such as dexamethasone. And one more drug is there that is only called as fluticasone. What is that? Fluticasone. What is that? Fluticasone. Okay. So hydrocortisone is acute adrenal insufficiency. Hydrocortisone tablet में नहीं आता है. Hydrocortisone usually comes in the form of injection, तो नहीं दे पाएंगे. So dexamethasone दे दो. टैबलेट फॉर्म में आता है, लॉन्ग एक्टिंग, बढ़िया सा मजेदार हो गया. ठीक है. कुशिंग डिसीज. कुशिंग डिसीज के अंदर देखो पहले ट्रीट the cause. Most importantly Cushing's के अंदर treat the cause. Okay, Cushing disease के अंदर treat the cause. Treat the cause मतलब it might be due to tumor. If it is tumor क्या करोगे? Adrenal gland में tumor है. If it is tumor then directly tumor को निकाल पे, उखाड़ पे. हाँ उखाड़ पे को tumor को surgical treatment. Okay, अगर मान के चलो if it is due to steroids, अगर स्टीरॉइड्स को लॉन्ग टर्म यूज कर रहा था जिसके वजह से हो रहा था, इफ इट इज ड्यू टू व्हाट इज दैट? स्टीरॉइड्स, देन स्टॉप द स्टीरॉइड्स. ओके, अगर और कोई टू रिड्यूस, टू डिक्रीज व्हाट इज दैट? कॉर्टिसोल प्रोडक्शन, टू डिक्रीज द कॉर्टिसोल प्रोडक्शन. ये मेडिसिन में भी पढ़े होंगे आप लोग. डिक्रीज द कॉर्टिसोल प्रोडक्शन, वी हैव मल्टीपल ड्रग्स सच एज मोटाटिन एंड यूर वन ऑफ द फेवरेट एंड गोल्डन ड्रग कीटाकोनोजोल. सर क्या बात कर रहे हो? Ketoconazole reduces the production of your steroidal hormones from your adrenal gland. ठीक है सर, ये बहुत इंपॉर्टेंट पॉइंट. ओके, अब आगे बढ़ते हैं. इंसुलिन यूजर्स, इंसुलिन का कहां कहां पे देना चाहिए? इंसुलिन कहां कहां देना चाहिए? सो टाइप 1 डायबिटीज मेलिटस, टाइप 1 डायबिटीज मेलिटस. ओके, दिस इज अ वेरी इंपॉर्टेंट पॉइंट. ओके, इंसुलिन और कहां दोगे? मतलब इंसुलिन विल बिकम द ट्रीटमेंट ऑफ चॉइस. IV fluids, IV fluids and insulin, ये दोनों कहां पे दोगे? IV fluid and insulin is given for diabetic ketoacidosis, diabetic ketoacidosis. So pregnancy diabetes mellitus, that is gestational diabetes mellitus. Again, you are going to give which one, sir? Yes, you are supposed to give pregnancy diabetes mellitus. चलो दे दो कौन सी? इंसुलिन. Okay. Then diabetes mellitus patient, DM patient, getting hospitalized. Okay, if he's getting hospitalized for any reason, if he's getting hospitalized for any reason, if the person is getting hospitalized, you are supposed to give insulin. Shift the patient onto insulin. Oral hypoglycemics use नहीं करते हैं. ठीक है. Failure of OH, what is that? Failure of oral hypoglycemic agent. Failure of oral hypoglycemic agent. Failure of oral hypoglycemic agent. That time also you are supposed to give. Then insulin को एक combination में देते हो, insulin plus glucose. Insulin plus glucose is given for hyperkalemia. Insulin plus glucose is given for what is that? Hyperkalemia. Insulin and glucose is given for hyperkalemia. Very good. You people are absolutely correct. Okay. Very nice. Then चलिए पढ़ते हैं, आगे चलते हैं. Van Willebrand disease. बताओ भाई ड्रग ऑफ चॉइस क्या है? Van Willebrand disease के लिए all of you tell me sir, factor 8 दे दो, क्रायो प्रेसिपिटेट दे दो, है ना? और कुछ दे सकते हैं क्या? So basically Van Willebrand factor नहीं है तो factor 8 का लेवल कम होता है. We can consider cryoprecipitate. Okay, cryoprecipitate. Okay, but apart from that एक ड्रॉप गिरने वाला क्वेश्चन, ये बहुत ये होता है ना, ड्रॉप द बॉम्ब, ऐसा ड्रॉप होने वाला क्वेश्चन है. यहाँ पे याद रखो, ये वाइल्ड कार्ड एंट्री है, ये है डेस्मोप्रेसिन. ये है कौन? Desmopressin. Yes sir, desmopressin is used in Van Willebrand disease. Okay, so please remember what is that? Cryoprecipitate and desmopressin both can be used. समझ में आ रहा है? फंसना नहीं है इसमें. ठीक है. रिमेंबर फैक्टर 8 भी दे सकते हो, डेस्मोप्रेसिन भी दे सकते हो. ये जो है ना डेस्मोप्रेसिन, ये तुम्हारा सर दर्द. ठीक है. सो इसलिए सर दर्द पूरा एग्जाम से पहले बता देता हूँ. सीधा एग्जाम हॉल के अंदर जाना, बैठना, क्वेश्चन आएगा, वॉमिट कर देना, मतलब सही आंसर वॉमिट कर. ठीक है. सो डू द वॉमिट, करेक्ट आंसर एंड ओके. डायबिटीज इंसिपिडस. अगेन डायबिटीज इंसिपिडस में बहुत सारे चीजें हैं. सो इफ इट इज सेंट्रल क्या करना है? If it is central क्या करना है? If it is a central diabetes insipidus, yes, you are going to use that is your vasopressin analogs. Vasopressin analogs. Vasopressin analogs. Okay. If it is central, what you are going to give? Vasopressin analog. If it is peripheral, Q desmopressin. Sir, desmopressin increases the production of yes, that is increases the production of Van Willebrand factor from your most importantly endothelial cells and your platelets. ठीक है, इसीलिए यूज करते हैं. Okay, so central desmopressin, that is vasopressin analog such as desmopressin. Okay, then if it is nephrogenic, if it is what? Nephrogenic. So for nephrogenic, sir, you are going to use thiazides. Okay, so thiazides have both the diuretic and antidiuretic property, तो इसलिए confuse मत होना. Increases the production of factor 8 as correct translation. Okay, so चलो nephrogenic diabetes insipidus के लिए thiazides. Okay, nephrogenic diabetes caused by ये भी important है. Nephrogenic due to whom? Yes, due to lithium. Okay, ये भी important. Okay, so due to lithium, अगर if it is due to lithium, then the drug of choice क्या हो सकता है? That is your amyloid. What is the drug? Amyloid. What is the drug? Amyloid. What is that? Amyloid. Okay, lithium induced. Amiodarone नहीं है, amyloid. Okay, चलो. Then the next important, to differentiate between central and nephrogenic. What is that? Central and nephrogenic. Which drug is used? So to differentiate central and nephrogenic, again the drug used is your desmopressin. Okay. ऑल ऑफ दिस आर ए वेरी वेरी इंपॉर्टेंट क्वेश्चन. सो इसमें स्पेशली ये वाली बात याद रखो, टू डिफरेंशिएट कौन सी यूज करेंगे, अगेन डेस्मोप्रेसिन. डेस्मोप्रेसिन देने के बाद सिम्टम डिसअपियर, इट इज सेंट्रल. इफ सिम्टम प्रेजेंट देन so desmopressin we give after desmopressin, desmopressin after desmopressin. If no symptom means oligouria reduces. If no symptom, that means reduction of polyuria, reduction of polyuria, then it is a central type. Then it is what? Central type. Okay, after giving desmopressin, polyuria is present. Still polyuria is present. Then it is a nephrogenic. Then it is what? Nephrogenic. Done, sir? SIADH, syndrome of inappropriate ADH production. इसमें भी again so newer drugs versus older drugs पे आप confuse होने का possibility होता है. SIADH का first line drug or drug of choice. First line drug or drug of choice is your Waptans. What is that? Waptans. What are those? Waptans. ये कैसा काम करता है? Vasopressin receptor. They will block the vasopressin receptor. That is your V2 antagonist. V2 antagonist, Waptans, such as tolvaptan and conivaptan. Tolvaptan and conivaptan. Okay. Other drugs which can be used earlier time, purane time pe other drug which we used to use is demiclocycline. Demiclocycline. So demiclocycline to antibiotic, yes, it is a antibiotic, but it had a side effect of reduction of ADH. That is why we used. But the answer here you need to remember is V2 antagonist. V2 antagonist. Okay. Drug of choice is Waptans. अगर कोई पुराना notes पढ़े हो, if somebody read a older notes, that might you write as a demiclocycline still. तो confuse मत होना. Newer updates के अंदर तो मेरा notes के अंदर तो मेरा classes में तो मैं तो बता दे चुका हूँ कि Waptans will be the drug of choice. But if anybody had read the older note, please update your information to Waptans. Okay. ऑस्टियोपोरोसिस के अंदर अगेन ज्यादा कुछ कंफ्यूजन नहीं है. ये मतलब अगेन ये कंफ्यूज हो जाते हैं, सर सरम देना है, ये देना है, वो देना है, कुछ नहीं. ऑस्टियोपोरोसिस नो आर्ग्यूमेंट. सी द ड्रग ऑफ चॉइस इज bisphosphonates. What is the drug of choice? Bisphosphonates. Okay. All right. Cerebral edema, again already we discussed mannitol. What is that? Mannitol. And mannitol is also drug of choice for acute congestive glaucoma. What is that? Acute congestive glaucoma. In both of these cases, the drug of choice is mannitol only. Okay. Bisphosphonates such as alendronate. Okay, so all of them end hota hai dronate se. Zolendronate and olendronate. Okay. All right, mannitol, very important question. Again, please do not make mistake. What is the drug of choice for cerebral edema, bachcho? Mannitol. That is used in acute congestive glaucoma. Okay. Pulmonary edema ka drug of choice. Again, pulmonary edema ka drug of choice loop diuretics. हमारा क्वेश्चन में usually the option what we are going to get is use best preferred drug is your Lasix. So Lasix is also called as furosemide. What is that? Furosemide. What is that? Furosemide. Okay. So can't give during the bleeding. We cannot give during bleeding, of course. And because it increases the quantity of extracellular fluid and it can cause, what is that? It can cause the excessive bleed also. But if ICP is elevated because of EDH or SDH, in that cases, yes, we can give. But if the bleeding is progressing, then we don't give. Okay. So that is again a lot of what is that? Practicing information. So don't have to worry. Just cerebral edema का drug of choice, please remember. Okay. Active hemorrhage if it is enlarging, मान के चलो EDH अगर size बढ़े जा रहा है, if it is keep on increasing, then you are going to give. Then you are not going to give. I agree with you. Okay. But if it is bleeding is not happening, okay, I mean clot is not progressing, तब दे दीजिए. ठीक है. Both of you, Pratik and Med, you both understood, I think. तो हाइपरकलेमिया में ट्रीटमेंट्स क्या क्या यूज कर सकते हैं, क्या यूज नहीं करना चाहिए. पेशेंट विद हाइपरकलेमिया, So the drug of choice is insulin plus glucose, insulin plus glucose, and also you are supposed to give calcium gluconate, calcium gluconate. Again, all of this should be given slowly. Calcium gluconate fast mat dena, patient पहुंच जाएगा. Okay, so calcium gluconate slowly IV. Then you are going to give salbutamol. What is that? Salbutamol inhalation, salbutamol inhalation. And also you can consider last step as dialysis. Okay, yes, dialysis is also a treatment, can be used in severe hyperkalemia, severe form of hyperkalemia. If it is like, you know, more than 7 something like that, that till the one patient has to be surviving. Okay, so if that is severe form of hyperkalemia, then yes sir, dialysis can be done. Okay, hypokalemia ke liye, yes, again here what we are going to give is KCl slow infusion, KCl slow infusion, KCl slow infusion. Okay, सो अगेन मेनिंजाइटिस, मेनिंजाइटिस के अंदर एक ही कंट्रोवर्सी है, वो कंट्रोवर्सी सबको कंफ्यूज करता है. रिमेंबर मेनिंजाइटिस, दे विल आस्क यू एम्पिरिकल ट्रीटमेंट, empirical treatment. Okay, empirical treatment for meningitis. Okay, so empirical treatment for meningitis. Yes, we will come to the magnesium toxicity sometime. I'll talk about little bit of your what is that. I will talk about your little bit of toxicities in few minutes. We'll talk about that. That time third generation cephalosporins, third gen cephalosporins, third gen cephalosporins. ओके, देन मलेरिया के बारे में पूछेंगे. मलेरिया के अंदर स्पेशली यूजुअली आस्क्ड इज प्रेग्नेंट फीमेल. इन प्रेगनेंसी मलेरिया में क्या करेंगे? सो प्रेगनेंसी मलेरिया वेरी सिंपल, वी हैव वाइवाक्स, वी हैव वाइवाक्स एंड वी हैव फाल्सीफेरम, फाल्सीफेरम. ओके, सो फर्स्ट ट्राइमेस्टर में क्या दोगे एंड सेकंड एंड थर्ड ट्राइमेस्टर में क्या? Okay, so for all the Vivox cases, first trimester and second trimester, what exactly we are going to give? Chloroquine. What is that? Chloroquine, because it is safe in pregnancy. Again, we are going to give chloroquine. What is that? Chloroquine. So chloroquine is a drug used for both Vivox. That is your Vivox for both of the, what is that? That is your first and second and third trimester. Okay, agar Vivox is there, sorry, if falciparum is there, then you are going to use quinine, quinine, quinine plus clindamycin, plus what is that? Clindamycin plus clindamycin. Okay, agar if it is falciparum, then ACT regime. Okay, ACT regime. So this is only very important question. So please don't get confused. AB question, this is also a question which has been asked previously. And tuberculosis, all of you know HRZD, so I'm not going to waste much time on which we already know. Okay, then CMV retinitis, again this is a direct point to be remembered. It is ganciclovir. What is that? Ganciclovir. Ganciclovir is the drug of choice for CMV retinitis. For herpes ke liye acyclovir, acyclovir. Okay, malaria in pregnancy already done. Malaria in pregnancy just now we discussed. Okay, चलिए आगे बढ़ते हैं. लोकल एनेस्थेटिक्स. सर लोकल एनेस्थेटिक्स का क्या है? टॉक्सिसिटी के लिए क्या देते हो? टॉक्सिसिटी, ये लोकल एनेस्थेटिक टॉक्सिसिटी पहले मोस्ट कॉमनली पूछा जाता था, मोस्टली आस्क्ड इन योर व्हाट इज दैट INICET. Okay, since it has been multiple times asked in INICET, so there is a possibility that it can come in FMG. Okay, very good, you people are absolutely correct. ATT drugs, ganciclovir, acyclovir, you are absolutely correct. Okay, so local anesthetic toxicity के लिए the drug which we are going to use, yes, that will be your intralipid. बच्चों क्या देते हो बच्चों? Intralipid. What will you give? Intralipid, IV intralipid, 20% intralipid infusion, 20% intralipid infusion will be the treatment of choice for local anesthetic toxicity. ये बहुत पूछा हुआ क्वेश्चन. Malignant hyperthermia का drug of choice होता है, that will be your dantrolene. The drug of choice for malignant hyperthermia will be dantrolene. Drug of choice for malignant hyperthermia will be dantrolene. Okay, चलो आगे बढ़ते हैं. So here are some toxicities. With the toxicities we'll be concluding our drug of choice class. So एक digoxin के अंदर मेरा प्यारे बच्चों सुनो, बहुत टाइम ये छोटा सा ट्रैप बनाते हैं, एंड वो ट्रैप के अंदर हमारे हमेशा गिर के आते हैं। ओके, सो डिजी बाइंड करके, ठीक है, व्हाट विल बी दैट, डिजी बाइंड। अब एग्जामिनर ने इतना ब्रिलियंट हो गया, वो डिजी बाइंड ऑप्शन में देगा ही नहीं, ही विल नॉट गिव डिजी बाइंड इन द ऑप्शन, सो ही विल गिव समथिंग कॉल्ड एज अ डिजॉक्सिन F एंटीबॉडीज, F एंटीबॉडीज, डिजॉक्सिन फैब, ये दिया होता है। डिजॉक्सिन फैब देके ये कुछ और सोच लेंगे आप लोग। ओके, सो प्लीज रिमेंबर, डिजीबाइंड अगर ऑप्शन में नहीं है, सर्च फॉर डिजॉक्सिन F एंटीबॉडीज, एंड अगेन दिस हैज बीन डन बाय प्रीवियस एग्जामिनर्स। क्या किए थे पता है, दे गिव ऑल द ऑप्शन एंड डिजीबाइंड वाज नॉट देयर, तो सब लोग गए लिडोकाइन मार्क के, बट लास्ट ऑप्शन में वो दिया हुआ था डिजॉक्सिन फैब करके। ठीक है, सो व्हाट इज द एंटीडोट फॉर डिजिटालिस, डिजॉक्सिन फैब। अगर डिजीबाइंड दिया हम लकी है, डिजीबाइंड नहीं दिया कोई दिक्कत नहीं, वी ऑलरेडी नो द आंसर, डिजॉक्सिन। Okay, so then the next point what we need to remember, sir, the next point, if digoxin induced ventricular arrhythmia, if this is the case, ventricular arrhythmia, only then your drug of choice will change into lidocaine, it will change into lidocaine. Okay, so I'm already seeing some of you are already telling me the answer fatafat. Yes, the warfarin ka antidote, it is vice versa antidote. What is that vice versa antidote? Warfarin ka antidote, what is that? Yes bacho, what is that? Vitamin K. What is that? Vitamin K. Then heparin का antidote, very good, that is your protamine sulfate. अगर कभी examiner like protamine sulfate, okay, what is that? Sulfate. अगर कभी कभार एग्जामिनर का दिमाग किसकेगा तो पूछेगा ये कहां से आता है, सोर्स ऑफ द ड्रग, सोर्स ऑफ द ड्रग, प्लीज रिमेंबर, सोर्स ऑफ द drug, source of the drug, please remember, source of the drug is sperm of salmon fish, sperm of salmon fish. Okay, ये पूछेगा तो जनरल फार्मा से पूछ सकता है, which of the following is derived from the animal, that is salmon fish, that is protamine sulfate. Okay, then next hit, what is that? Heparin induced thrombocytopenia, what is that? Heparin induced thrombocytopenia, thrombocytopenia. ओके, सो इसके अंदर दो तरीके होता है, हिट का टाइप 1 and hit का type 2. Type 1 is nothing serious, it will go on its own. So, but both of them, what is an anticoagulant? We are going to use something called as argatroban. What is the name of the drug? Drug of choice is argatroban. If argatroban is not there, you are absolutely correct. We are going to go for lipuridine. What is that? Lipuridine. Okay. So ethanol के लिए, ethanol toxicity के लिए, what is the name of the drug? We are going to use fomepizole. What is that? Fomepizole. What is the name of the drug? Fomepizole. For methanol, we can use both fomepizole. If that is not there in the option, you can go for ethanol. Both of them are correct answer. So both of them are correct answer. Any one will be given. Okay, lithium overdose का treatment, only thing which can be done is dialysis. What is that? Dialysis. Very good. lithium overdose का dialysis. Iron के लिए again acute iron toxicity, the drug of choice. बच्चों ध्यान से सुनो, what is the drug of choice? Deferoxamine. For acute iron toxicity, deferoxamine. Okay, तो क्वेश्चन कैसा देगा, छोटा बच्चा था, a small kid by mistakenly ingested 10 tablets of iron, that is a acute iron toxicity. Okay, अगर chronic iron toxicity की बात हो रही है, मान के चलो क्या हो रही है, chronic iron overdose. So the chronic iron overdose usually due to transfusion repeatedly. If repeatedly transfusion hota hai, then the answer will change. Okay, for chronic overdose we are going to use deferriperon. डेफेरिपेरोन। इफ डेफेरिपेरोन नहीं दिए सर क्या करे? सो यू आर गोइंग टू यूज deferoxyrox. So these are the two drugs, deferriperone and deferoxyrox, two drugs which are used for the treatment of chronic iron toxicity. Okay, for the lead and mercury. So we are going to use dimercaprol. What is that? Dimercaprol. इसका दूसरा नाम होता है dimercaprol, or we have something called BAL. What is that? BAL. BAL is nothing but, इसका full form भी पूछ सकता है, British anti levisite. British anti levisite. This is the name of the BAL. Okay, so this is a story of most important drug of choices. यहाँ से इतना गारंटीली बोल सकता हूँ कि there will be many question, जो मैंने ऐसा ट्रैप आएगा बोला हूँ ना, so that pattern of traps only will be there. तो इस चीज को बहुत अच्छे से यूज करो. Okay, on the day of exam also, before going to the first paper, just quickly within 2-3 minutes, just scroll this PDF and go. Okay, I will provide you with the PDF. Okay, that Paras will from Dr. Paras said we will upload it in your group definitely. Okay, अपना ग्रुप में आ जाएगा, सब लोग इसको यूटिलाइज करो. The questions, no, there can be repeated ditto questions are high likely possible. तो ध्यान से सुनो, डरो मत. You'll get through this exam. Just keep yourself calm. Do not get very much tensed. Okay. So again, please have your food and go. Do not go without food. Please have some little bit, sir. In anxiety, you will feel vomiting. Just have some sneakers or something like that. They will not allow you to take any food inside. They'll not allow you to take any water bottle. No pens are supposed to be taken. Whatever all ticket, everything is required. Keep them ready by tomorrow evening itself. Okay, keep 2 copies of all ticket बच्चों. ओके, कीप 2 कॉपीज ऑफ हॉल टिकट. गलती से एक को कुछ हो गया, चाय वाय गिर गया, कुछ भी हो गया, तो वहां पे जाके आपको टेंशन ना हो. ओके, कीप 2 सेट्स ऑफ हॉल टिकट. कीप योर आईडी विथ यू. यू नीड 1 आईडी मैक्सिमम, तो मल्टीपल आईडीज लेने का भी जरूरत नहीं है. ठीक है. एंड water bottle you don't have to carry inside. Do not wear a belt. Normally थोड़ा पैंट, especially the people who are lean like me. ठीक है, ये सारे बहुत अच्छे से फॉलो करना है बस. ओके, बहुत अच्छे से फॉलो करना. पीपल हु आर लीन लाइक मी, बेल्ट के भरोसे पे लूज जीन्स पहन के मत जाया. समझ में आ गया? बहुत मुश्किल हो. ओके, लूज जीन्स पहन के मत जाया करो. दैट इज वन थिंग. आप लोग एग्जाम सेंटर पहुंचोगे, सो व्हाट एंड ऑल विल हैपन, तो स्टेप बाय स्टेप आई टेल यू जस्ट विद इन 2-3 मिनट्स, ताकि आप लोग प्रिपेयर्ड रहे. तो सुबह उठोगे, आराम से 6 बजे उठो, प्रिपेयर हो जाओ, तैयार हो जाओ, अपना डॉक्यूमेंट वगैरह फिर से सुबह चेक कर लो. ठीक है, एवरीथिंग, ऑल ऑफ द डॉक्यूमेंट्स अगेन चेक वन. गो टू एग्जाम हॉल. आफ्टर यू एंटर द एग्जाम हॉल, आई थिंक by 7 to 8:30 will be the entry time. So if you enter the exam hall by 7:45, 8 o'clock will be sufficient, good enough time. But reach the exam hall. Reach the exam hall. If you want to stay outside for some time, then later you enter, no problem. Okay. Then next important thing, exam hall के अंदर do not try to talk to people. Okay, because there'll be cameras around you and they will announce your name or something, computer number on the mic, saying that don't turn this side, that side, like that. Okay, be careful with those. All right. Then next important thing, अगर किसी का आंसर, अगर मतलब किसी से आंसर ये था वो था करके बदलो मत. ओके, वो सब डिपेंडेंस छोड़ दो. डू इट बाय योरसेल्फ. ठीक है. एग्जाम हॉल के अंदर जाओगे, सर जाने के बाद क्या होता है, दे विल चेक योर बायोमेट्री. Okay, so there are places where they'll do multiple biometries. There are places there might be single biometry. That up to completely depends upon exam conducting board. Okay, so you'll go inside, you'll do a biometry. They'll assign you a computer. You'll go sit in front of that computer. And वहां जाने के बाद आप लोगों को क्या होता है, हाफ एन आवर का टाइम होता है. उस टाइम पे तुम्हारा साइड वाले इधर इधर लोगों से बात कर सकते हो. That is because exam has not started. Then after some time, so they will announce you the all your मतलब एग्जाम को स्टार्ट करने के लिए कुछ पासवर्ड वगैरह, they will announce it. So after they announce it, you enter the computer, then you will start getting your questions. Okay, sir क्वेश्चन आने के बाद सॉल्व करने का तरीका क्या है? So if you completely confidently know the answer, just mark the answer and go ahead, never look back. एंड ऐसा लगता है कि हमारा जिंदगी में कभी सुने नहीं है, वी नेवर हर्ड ऑफ दिस डिसीज इन आवर लाइफ, वी डोंट नो द आंसर। वैसा क्वेश्चन में फर्स्ट आंसर वट एवर यू लाइक, मार्क दैट एंड गो ahead. That's it. Do not look back, because there is a possibility that you can get it right, because it is not just about the luck. It is a scientifically, अगर गलती से कई एक बार पढ़ा हुआ था, your brain will try to help you by making you, अरे यही हो सकता है, यही हो सकता है, वैसा वाला मार्क करो, आगे बढ़ो। If you get a doubt between two questions, if you like, two options, if you get a doubt between two options, then you don't put that question directly for review, बच्चों directly review में नहीं डालना चाहिए। In among those whatever you feel correct, mark the answer, put for review, then go to the next question, okay? And again last में आके मार्क करेंगे, रिव्यू के लिए लगाएंगे, वो सब ज्यादा मत किया करो। The more questions you put in review, तुम्हें कंफ्यूजन आ जाएगा कि यार कौन सी ऐसी इंपॉर्टेंट चीज था मैंने रिव्यू में डाला था। I meant to tell you, so if you put more questions in review, you'll start to get confused कि what is that, yeah, which one I need to focus more. That is why don't put many questions in review. And even if you're putting in review, mandatory one rule you remember, mark one answer and definitely keep it for review. I agree. And do not leave out any question, ओके? एक क्वेश्चन के चक्कर में, मतलब क्वेश्चन का आंसर इफ यू नो दैट व्हेन यू ऑलरेडी मार्क्ड इट राइट, डू नॉट वेस्ट योर टाइम बाय लुकिंग दैट अगेन एंड अगेन, बिकॉज यू विल रिक्वायर टाइम फॉर a little bit clinical type of question. Clinical question, how much ever lengthy it is, do not get scared, okay? Pick up the important words once you read the question, combine them, mark it, okay? And sir एग्जाम हॉल के अंदर कौन सी बुक्स ले जाना है? सो इन माय पर्सनल ओपिनियन आई वुड एडवाइज यू पीपल, तुम्हारा कोई लास्ट मोमेंट रिवीजन का मटेरियल बनाए होंगे ना, सो फॉर एग्जांपल सच एज पैथ, बायोकेम, फार्मैक, राइट? सो टेक दोस मटेरियल्स, okay? Don't carry full notes, that is not a great help. Take those materials, go to exam hall, and in front of the exam hall, when you get time, quickly that day morning, so from the first paper I would tell you quick revision is required for 3 subjects, because this will help you score biochem and your what is that, pathology, and one more is your this thing, what is that, pharmacology, okay? These are the 3 things I would recommend. Then first paper you'll give, come out, after you come out, one more mistake many students come, you start discussing about first paper, okay? वो कोई दिक्कत नहीं है, शाम में पूरा टाइम डिस्कस करने के लिए, like full time is there for your discussion, समझ रहे हो मुझे? So full time is there for your discussion. तो शाम तक पेपर को वापस डिस्कस नहीं करना है, तो मॉर्निंग when there is a break, go eat some little bit food, okay? I know that you are in anxiety, little bit food is mandatory, because by afternoon your brain would have taken up all the glucose, exhaust हो जाओगे, second paper में नींद आ जाए, okay? So that's why I'm telling you people, please get some food. After that, open your gynae surgery, okay? So the big subjects whatever is there, quickly go through the image based questions, at least images, okay? That will help you a lot. Then you go finish your second paper. Second paper में भी उतना ही है, so there will be some of them can be lengthy question, but it will be fine, you can handle it, okay? So this is how you need to handle your exam. Sir कल रात का क्या सीन है? कल रात का सीन कुछ नहीं है, नींद नहीं आएगा फिर भी सोना है, you'll not feel sleep, but still you have to sleep. So for that, what you need to do, sir, like I'm getting too much of anxiety, shall I go and take some medication? वो गलती मत करो, क्योंकि मेडिकेशन की वजह से अगर ज्यादा सो गए या नहीं तो सुबह स्टिल यू आर फीलिंग ड्राउजी, एग्जाम तुम्हें डिफिकल्ट हो जाएगा ब्रेन यूज करने में, तो कोई एंटी एंजाइटी मेडिकेशन वगैरह यूज मत करो। उतना ज्यादा लग रहा है तो I would recommend you people, tomorrow by 8:30 9 o'clock maximum, eat heavy meal, try to sleep, नींद नहीं आएगा, फोन को साइड पे रखो, do not look at your phone, keep your phone to your side, by 9:30 shop close your eyes, just relax the bit. If you don't get sleep also, that is also like extreme level, like you don't get any sleep, that time also at least give your body physical rest, do not think about anything, close your eyes and just lie down in the bed, okay? At least do that, maybe after some time you will get the sleep, but please do not waste your time by reading the exam previous night I will read fully. Yes, definitely your logic is correct, but if it was one paper logic is easier for us, because एक paper तक खत्म हो गया आ गया, but that is not the scenario, no? By second half इतना नींद आएगा ना भैया, मतलब तगड़ा नींद आएगा। तो उस टाइम एग्जाम हॉल में जाके सो जाएंगे, वो गलती नहीं होना चाहिए। तो गिव योर बॉडी, आईज, ब्रेन सम रेस्ट। ओके, सो दिस इज माय एडवाइस। ऑल द वेरी बेस्ट। बोलते रहिए आई विल पास एंड डेफिनेटली विल पास, and all our prayers is with you. Definitely will pass. All the very best for everyone, my dear students. Okay, do very great job, and definitely you all will pass with the flying colors. All the very best. And whatever we discussed, of course इसका पीडीएफ मिल जाएगा, डोंट वरी। सर हम इसको लिखना चाहिए था क्या, तो इतना कोई टेंशन लेने की बात नहीं है, मैं पीडीएफ भिजवा दूं। ओके, ऑल द वेरी बेस्ट, अच्छे से करो, ठीक है। और एग्जाम होने के बाद सब लोग फार्मा का जितना भी क्वेश्चन आया हुआ है, सब लोग प्लीज, एक रिक्वेस्ट है, एग्जाम के बाद, अभी नहीं, बाद में वट एवर यू कैन रिकॉल, प्लीज डू लेट मी नो द क्वेश्चंस। दैट इज वन काइंड रिक्वेस्ट दैट विल हेल्प द नेक्स्ट स्टूडेंट्स टू प्रिपेयर। ओके, ये एक रिक्वेस्ट है आप लोगों से बस। ऑल राइट, एनी क्वेश्चंस? One sec, very slow. Bye guys, good night, study well.